Good morning, everyone. I extend a warm welcome to all of you on behalf of Finance of Dental News to today's webinar. As dental students, we spend years mastering theories, tests, and examinations. However, there are certain aspects of our profession that requires decision making, handling mistakes, and navigating real-world challenges that are not always covered in textbooks, or at least not in a way we fully appreciate at the time. That's what makes today's session especially meaningful. We are privileged to have with us Dr. Abhishek Rupani, an oral and maxillofacial surgeon and co-founder of Eximate Life Sciences, who will be sharing his experiences and insights from his professional journey. Without further delay, I invite Dr. Rupani to begin the session. Over to you, Doctor.
Good morning, everyone. I'm glad to see. uh, Sorry, I think there was a technical glitch. I am not very tech savvy, so you have to bear with me. So, thank you so much for being here, that too on a Sunday morning. Glad to see so many people here. And so, I'm still working today, so if I have to just be off for a few seconds or few minutes, right in the middle of the webinar, kindly do bear with me. So, why did we choose this topic? So the reason being that there are many speakers around who have been teaching you academic topics, and you might just be learning other theoretical topics into your college and with your books around. But there are some things which, hello, am I being audible?
Yes.
Yeah. So there are some things, some challenges that you face while you are going through your dental college, and there is still lack of guidance around these topics. There is nobody to tell you what all has to be done. How can you navigate a particular problem? So this is why this particular webinar, and I'm more than obliged to maybe help you guys with your problem. So I'm not going to keep this webinar as a one-way communication. I don't want it to be a pravachan from my side. I want it to be a bit interactive. You guys can step in, ask your doubts, and in the meantime, I'll start off with the questions which I received from the organizers. So I'm going to start with the topic of the things which I believed in dental college, which turned out to be wrong. All right, there are many misconceptions that we do carry around, and hardly find any guidance that someone might just be able to guide us of how to navigate this particular problem or a thing. So the first thing is that you might have heard people talking about that theory is okay, but you rather concentrate more on practical. Anybody has been through this notion?
Yes, sir.
So up until now, according to my experience, I would say that theory is as equally important than the practical work. Of course, you should not be negating your practical work, but you have to be as much thorough with the theoretical part as well. So let's say, for an example, while doing an extraction or doing a surgical extraction. So now, if you don't know the theory, if you don't know the structures passing through that particular area or the muscular attachments, how are you supposed to navigate if any complications happens during that time? So I would say that theory is equally important. You should be paying equal amount of importance to theory as well as to the practical. Secondly, being this thing was told to me by my UG college principal. So he used to always tell us when we were in a first and second year that before becoming a doctor, you should look like one. See, our profession is a sophisticated one. All right. There is a basic and bare minimum amount of aesthetic that should be maintained. Now, sometimes I see people who are not into professional clothes. I have seen dentists sitting into the clinics with t-shirt and jeans. Now, it's okay when you're traveling outside. It's okay if you're going out for a movie. But when you are into a professional space, you have to look professional, you have to behave professional. There has to be some sort of sophistication into you. And to be very honest, people do expect a doctor to look like a profession. You cannot be having unkempt hair and unkempt clothes and sit in the clinic and explain to the patient. See, it's difficult for you and for anybody who has been into the practice, from making the patient sit on a consultation chair to the dental chair. And for that, the patient needs confidence in you. And it is correctly said that the first impressions do last. So you have to look like a doctor, you have to be a thorough professional, you have to have that sophistication, the way you talk, the way you explain the treatment to the patient, the way you are dressed. Now, the third being saturation in dentistry. Now, what I have observed in my years of clinical practice, I practiced for 2 years after my undergrad, and it's been almost 1.5 years after my post graduation. And there might be a lot of dentists, maybe hundreds of them in a particular city, but yet there is a lacune in skilled and competent dentists. So I was a part of the hospital previously where I was made in charge to interview some of the dental candidates which they were planning to hire for their dental department, BDS practitioners. And believe me, I'm telling you that out of 15 or 16 applications that we received, 10 were rejected just because they possessed less amount of skills, the basic skills which is expected from them. Nobody is expecting you guys to do a surgical extraction or do an upper molar RCT. That is why you have consultants, that is why you have super specialty doctors. But right from maintaining a dental clinic, right from maintaining the dental records, right from talking to the patient, explaining the patient the dental treatment in clear and in the most common eligible words so that the patient can understand. All right. Sometimes the patient might not just be aware of what is orthodontic treatment. You have to explain it to them that we'll be attaching wires to your teeth and put them into proper alignment, something like that. So you have to be very clear and specific. And apart from that, managing the patient on the dental chair, it's very important. Nobody, as I said, nobody is expecting you to do a difficult case. But managing the patient, if the things get serious, or let's say if you're doing a particular procedure and if it goes haywire, you should be able to primarily manage the patient, assure the patient, and then maybe call in a specialist if you're stuck somewhere or take help from some other dentist. So I would say, go on saying that there might be saturation in the numbers quantitatively, but qualitatively there is still a big lacuna. So there is nothing like saturation. You have to be thorough with your basics. As a BDS dentist, you're expected to be thorough into the normal dental general dentistry procedures, right from scaling to restoration to composite to GIC to explaining the patient about their treatment plan, and also maybe diagnosing some of the dental and oral conditions that the patient might present with. That's all. But nowadays, people do not pay attention. They just directly want to go on to learning extraction of wisdom teeth, extraction of surgically impacted molars, or maybe implants. I've seen BDS students right into their internship, or let's say just after passing out BDS, they're going into implant dentistry. Talking about zygomatic implants, I think it's still premature on our part to think that we should be directly going for the advanced procedures before getting thorough with the basic ones, because that is what is expected even if you go out looking for a job into a clinic or a corporate clinic as well, such as Fine Feathers or Club Dental or anything. So basics are really important. There is no saturation for a good skilled dentist. I'll repeat this: no saturation for a skilled dentist. Now, the other thing is that practice in college is different from practice in private clinic or private hospital. Now, see, you might have seen, I suppose you all are in college. Is anybody a practitioner here?
No.
Just a show of hands. Just like this. Just like this. Now, if you do this show of hands, I would know that not everybody is sleeping. Am I audible? Okay. So, see, when you are practicing in the dental college, the patient knows that I have to go into this particular department because he has already been explained everything into the OMR department. Now, majority of the patients flock inside the dental college because they are getting subsidized treatments, but it's not the case with patients in private clinic. To me, it takes a lot of effort and a lot of mastery and self-confidence to explain the patient a treatment of 5,000 rupees or 10,000 rupees, or let's say if you're convincing a patient for 25,000 rupees. Now let's take an example of yourself only. Now, how would you feel if the doctor is inconfident, if the doctor is not sure about his or her treatment plan? Would you be convinced to spend 20, 25,000 or even 5,000 rupees for a particular treatment for yourself or for your family or for your mother or your father? I don't think so. And I'm sure you would all agree. So the practice in college is very much different from practice in private clinic. You have to be very clear cut about your treatment plan. You have to have that confidence. And let me remind you again that confidence comes with a good theoretical knowledge as well as a good practical knowledge. If you don't have these two, you won't be confident in yourself while explaining the treatment plan to the patient. So theory as well as practical again are very much important to bring out that confidence into you in front of the patient. And I'm telling you, the patient can see the confidence onto your face. This is a real life experience. When I was not confident, I came to know the patient realized this during my initial years of practice. So yes, patient can make out that if you are confident with this particular treatment plan or not. So again, you have to be confident with your treatment plan. Then again, you have to explain the patient into simple layman's language, the treatment. You cannot be talking about all the technicalities and all the technical words that we use in dental college in front of the patient, because patients might just not know all these words. So you have to be very crystal clear and explain them into layman's language of what the treatment that you're going to be doing, what all possible complications it might have, and what is the treatment time that is going to take, and lastly the charges, how much you're going to charge the patient for this particular kind of treatment. And one notion which I also had during my college years was that, and I'm pretty sure many of you might also have this particular notion, that when you look at your senior, or maybe your friend who is a practicing dentist, or maybe your senior who is going through his post-graduation or has recently set up a clinic or is 3 or 4 years into the practice and doing very well, you might think that they must have all figured it all out. They might just know everything. So the reality check is that nobody has it all figured out. Everybody is navigating, everybody is going through the process, everybody has been through the process of what you are facing right now. So everybody has been there, everybody is going through it, and you also have to get through this process no matter what. Now, if you have any questions or the questions which we had from the organizers, can we discuss that?
So the first set of questions which are frequently asked, which is surviving and thriving in BDS. What can I do as a dental student to stand out from others? What qualities should I develop during my BDS journey? Also, should a second or third year student should work in a dental clinic as an assistant, or is it just waste of time?
So that's a very wonderful question. This is something which I used to wonder myself. And may I know who has asked this question? Is it okay for you to maybe? All right. So when you're going through your pre-clinics or your clinics or maybe your studies, and you might face some hiccups, some hurdles, and you might just think that you are just not able to get through it. In simple philosophical and practical words, if I just quote one line, it would be just stick a little longer with your problem. That's all. If it is not happening in the first go, try it three more times. If it is not happening in five goes, maybe the 10th time, but it is going to happen, believe me. I was a bit ashamed to say this, but I was not very good during my preclinicals. Not very good. I used to see my friends get the work done way early than I used to get it signed. I used to look at them that in the first go, some of my friends, they used to do the teeth setting, do the cavity prep. And it sometimes used to take me 10 goes, sometimes 15 goes. I'm not kidding. I'm not exaggerating also. See, everybody is different. See, if you might just not be able to do good in, let's say, prosto preclinics, you might just be good in endodontics. And if you're not good in endodontics, you might just be good in orthodontics. And let's say if you're not good in all three, you might just become an oral surgeon just like me. So either you don't have to take endo, you don't have to take ortho or prosto. So in simple, clear, legible words, I would say keep on going. Don't feel ashamed. Everybody has been there. You might think that it is just you. No, I can make you count hundreds of people, including me. Including me. And I have stories that would make you laugh on how I used to go on around my prosto practicals, my ortho practicals, my endodontic practicals, or the conservative ones. But that is something for the other time. But I have to tell you that it's just try once more. Just once more. And do not quit until it happens. Do not quit. It is going to happen. If not the second, then the fifth. If not the fifth, then the eighth. If not the eighth, then 15th. But it will happen. That is for sure. If I can do it, and if I was able to do it, I was very poor with my practicals, then I'm pretty sure you might just be able to do it. Secondly, the question that what can you do to stand out from the crowd? Stay a little longer. Stay a little longer in the practicals. Stay a little longer while you're observing a case. Stay a little longer in the library. If somebody is reading for 4 hours, you read for 5 hours. If somebody is observing one case, you go on observing two cases. If somebody is asking one question, two question, you ask three questions. Clear all the doubts. See, I read this particular quote long back that it goes on saying that the one who asks a question is a fool for once. The one who asks a question is a fool for once. The one who doesn't is a fool for lifetime. So rather it is okay to look like a fool and ask the question, get your answer and learn from it, rather than never asking a question and being a fool for lifetime. So just stay a little longer. Be it anything. Be it studies, be it observation, be it doing the preclinicals. Let's say you've done your cavity prep for the 5th time and you're still not able to get it approved and still not able to make it right. Go for one more time. Even if it is the 10th time, go on one more time. This is the simple logic that I can just tell you, that stay a little longer with the problem. That's all. And it is okay. It's all okay. Everybody has been there. And no need to compare yourself with others. Everybody is different. Everybody is made for something different. Your friend who is able to approve his or her preclinical operative work, cavity preps and all in one go, might just go on to become a very good endodontist, and you might just go on to become a very good orthodontist, or let's say oral surgeon. So everybody is different. It's okay if you're not able to do it in one go. Stay a little longer with the problem. That's all.
Very well spoken, sir. So, next question: why do preclinical subjects feel so difficult and frustrating?
I guess the exact question was why preclinicals are so sucky. Who was that?
So we have to modify the statement.
No, it's okay. It's okay. It's an informal conversation. So before the teachers and before the college allow you to do anything on the patient, you have to do it on a model. If you're not able to do it right on the model, how are we supposed to know that you might just be able to do it good on a live human being? So yes, they might feel frustrating, but I'm telling you, once you're through that first 2 years of your BDS or first three where you're going through your preclinics, and if you've done it correctly in a proper manner, the way it is guided by your teachers, I'm telling you, is going to help you a lot. When you do your patients, you would realize that you are more easily able to manage the patient and able to do it in the patient in a better way. See, even though you are into a college setup or an institution setup, you still have to be answerable to your patient, right? Even if you make a blunder there, or even if you do a mistake, you still are answerable to the patient as well as to yourself, right? This is your skill, this is a profession. So preclinicals are important. They might feel so sucky in the beginning, but they are very important. I'm telling you guys, it is okay if you're not I'll repeat this again, it is okay if you're not able to do it in one go, three goes, five goes. Just stick a little longer. It will happen. Everybody has gone through this, especially me, and I'm telling you, I have turned out fine.
So, a slightly tricky question: how to manage time effectively between studies and personal life?
Okay, so you have to remember, when you leave the college at 3 o'clock or 4 o'clock, whatever timings are, you just remember that to keep all the things which belonged in college itself. Once that door closes, no need to bring that outside the door. And when you are overwhelmed, when you are going through a difficult phase, talk to somebody. Be it your mother, be it your father, I don't know. Very few can be very frank with your dads, but your friend, talk it out. Try to keep things in college itself which belong to the college. Once the gate closes at 3 p.m., no need to get things out from there. You will face it the other day. Kal ka kal dekhenge, it's a very common saying. It's difficult. I can understand. Matlab, some things, maybe a scolding from a teacher, or a spat between your friends, or something wrong going in the clinics or pre-clinics, or a disagreement with your colleagues can maybe ruin your day, and you might just not be okay with what you're going through, and it might hamper your personal life. And it happens with everybody. It still happens, and it is going to happen. It's, I would say, part and parcel of life. But again, you have to try and manage to keep the things, professional things on professional side and personal things on personal side. It's difficult. It's easier said than done, but it again requires practice. So, so there was this one more question from the previous set, that what are the qualities one should inculcate in their BDO journey? So there is an underemphasized thing called as observation. I don't know how many of us has emphasized onto that, or how many people would have told you to go and observe, but observation is as important as reading a book or as doing a procedure. Some of the best things which I learned in minor oral surgery was simply by observing my seniors. So whenever you get a time, you're sitting there into your clinic, you're done with your work, or maybe you did your patient and maybe it's not your chance to do the patient. Get up from your chair, go to that senior who's doing a procedure and ask them very politely, "Can I assist, please?" and I'm pretty sure 80 or 70% of the crowd is not going to say no to you. See, just by observing even the smallest of things, see, these are always underemphasized. How to correctly hold a periosteal elevator, or even rather a mouth mirror, without stretching too much cheek of the patient, without causing too much trauma to the patient or inconvenience to the patient, is also an art. You're going to realize all this when you go into private practice. See, when you sit in a dental clinic and you expect a patient to pay 10,000 rupees for a particular procedure just because you know a skill, the patient also expects you to be very sophisticated, very thorough with your procedure. Nobody is going to shell out, forget 10,000, nobody is going to shell out 2,000 for you if you're not very much thorough, and if you're not skillful, and if you're not sophisticated, and if you're not good in your craft. So majority things which I have learned in my oral surgery practice is just by simple observation. Observation also teaches you that what kind of a I should not be saying this, but again, what kind of a mistake that person is making, so that you should not be making that mistake. So observation is an very underemphasized, undertold, and underexpressed skill. Do not sit in the clinics, do not warm up the chairs. See, 9 to 3 or 9 to 2 or 9 to 4 is the time where you have to be onto your toes. You can go and relax after that. But you ideally should not be sitting during that clinical time. So yes, that is one of the qualities I would say. See, apart from being thorough with your theoretical as much as practical, being thorough with your personality, the way that you talk, the sophistication that you carry, which would depict you as a doctor, and it starts right from college. Believe me, whatever you do in college, whatever way you carry yourself, whatever things that you do in college, you're going to mimic that outside. No magic is going to happen once you start your own clinic or go into private practice. Whatever is inculcated into your muscle memory, you're going to do the same thing going outside. So please don't be under that misunderstanding that यहाँ पे मैं ऐसा कर रहा हूँ चलेगा, बाहर जाके I'll do it better. No, you won't be able to do it better. You will only do and you will only perform what you have been doing in your college for 5 years. So if you cannot talk to the patient in a sophisticated manner, if you cannot convince the patient, if you're not well groomed, if you're not able to get thorough with your skills in your college, you 100% cannot do it outside. That is one thing which I've learned 100%. I've seen this in students, I've seen this in BDS practitioners. So whatever you do in this 5 years, you're going to replicate this in your private practice. And the last follow-up question was that as a second and third year student, is it okay for me to do an internship at a dental clinic? Yes. What good are you doing by sitting at home? Majority of us are doom scrolling reels on Instagram and Facebook, going out, hanging out with friends, rarely following any hobby. So until unless you're doing something fruitful in your evening time, yes, go and assist at a clinic. Ask them that, can I be an observer? Hardly anybody is going to say no. So yes, go out there. If your plan is to become a dentist, if your plan is to go out, practice dentistry, get into masters, or let's say if you want to go out and become an oral surgeon, pursue your master degree in oral surgery, go out and observe at an oral surgeon's clinic. It is tremendously going to help you, I'm telling you.
That was great, sir. Moving to next set of questions, which I'm assuming every student must have thought in their BDS. Should I start preparing for NEET MDS early? Is pursuing MDS necessary in India, or can one build a successful career now?
So as for preparing for MDS, that's quite a misunderstood analogy. If you prepare well for your first, second, and third and final year, you are already preparing for NEET. The syllabus is the same. See, while you prepare for your NEET, you have to go on practicing MCQs. Now, those MCQs are ultimately based on the theory which you read during your third and final year specifically. General med, general surgery, oral paths being very important, oral medicine and oral surgery again being very important. Endodontics, again, they have a lot of questions from conservative endodontics. Prosto has a lot of questions. So rather than focusing on preparing for NEET from now on, how about you go on reading and understanding the concepts of all these subjects very thoroughly right now, so that when you are into your internship, the only thing left with you is to prepare for these MCQs. That's all. So that's a wrong notion. You are not separately preparing for NEET. Whatever you are reading in your second, third, and final year, also first year, anatomy, the questions of anatomy are sometimes quite a lot into the NEET MDS. So yes, whatever that you're reading right now, please concentrate onto that. That is your ultimate preparation for your NEET.
Following that question, what key areas should one focus on while pursuing MDS to maximize learning and future success?
During MDS or while preparing for MDS?
While pursuing MDS.
So do we have an MDS resident maybe here in the crowd? Do we have anybody pursuing MDS into this crowd?
No, so we don't have.
All right. Even while you're pursuing your masters, again, observation is of prime importance. You cannot be sitting during your clinical hours. You can rest maybe afterwards, but go on, stand there, see what the person is doing. It might be a different, see, it might be the same procedure, but many doctors, every individual has a different approach to that particular problem, to that particular patient. You might just learn a better skill to do a particular kind of a patient, or let's say in this case, extraction. So I have seen 3 oral surgeons take out a same lower wisdom teeth in 3 different manners, and they were all good into their approach. So I learned 3 different ways to approach a wisdom tooth. So observation is of prime importance. Secondly, when you are into your MDS, you are expected to be the master of that particular field or branch. So apart from reading your textbooks, you have to also go on read the recent researches happening into your field. The previous research is done. There is plethora of articles there on Google Scholar or PubMed or Science Direct. So just type in the topic into all these portals. Let's say surgical extraction of wisdom tooth, and you will find more than 100 articles experimenting with different set of local anesthesia, experimenting with different set of flaps design, experimenting with different set of post-operative medications that are being given to the patient, to different techniques of removal of the tooth. So again, reading all these new research, new technology, and new articles which conclude what is the better way to do a particular procedure, and again, getting as much hands-on possible for a particular procedure during our MDS. So let's say if it's RCT, or let's say if it's restoration or composite, or is it removal of wisdom tooth. So getting as much hands-on as much as possible for that particular patient. So because how the number of times that you repeat it, it gets into your muscle memory, and after a point you would just be able to do that particular procedure in a fraction of time, in 15 minutes, 20 minutes. So repetitive practice, good theoretical base in knowledge is as important as practical, and observation, again and again I'll emphasize, observation is very important.
After understanding patience and practice, the next obvious question which we get is where can this degree actually take you? In PDS scope.
I didn't get you, sorry.
What are the scope after we complete our BDS? After our level?
All right. So just because you have studied for 5 years the science of dentistry, that doesn't mean that you have to pursue dentistry. Please don't fall for that wrong analogy. Okay, if I have had friends who have done go on to do different things, are doing very good in different professions, and are happy with their professions. Somebody has got into public health, somebody has got into hospital administration, somebody's who has done his MBA and is into corporate, and somebody is into clinical practice, somebody is doing their masters. One of my juniors, which I came to know later on, she did her MSc in anatomy. Now she is employed in medical college. So just because you have been through 5 years of dentistry, that doesn't mean that you have to follow dentistry. If you think that you are better in something else, if you think that you would want to experience something different, or you want to go out and venture out in something, into entirely something different, into your entrepreneurship journey, maybe start a business, go on. These 5 years were just your base. These 5 years were meant to groom you into a better person, not make you stick to a particular branch. So yes, apart from all this, you can venture out, open up your clinic. Secondly, you can go for masters. Thirdly, you can go abroad. There are a lot of options: US, UK, Canada. They have different pathways. There's something called as INBD, which you have to give for your licensure in USA. And for UK, you have to give ORE. And there's something called as LDS for London, practicing in London, UK. Then there is a particular set of examination if you wish to pursue dentistry in Germany, in European countries. So you can also do that. But I would suggest that if you stay in India and if you wish to practice private practice dentistry in India, I would say MDS is a must.
Moving towards next set of questions, which are dealing with academic and institutional challenges. What are the key things a BDA student must do, and what should be avoided during college and departments or schools?
So I have this question over here. So as we already discussed, one thing again which I'm going to emphasize is don't sit, observe. All right, the reading part or learning your theoretical things can be done at home, but the procedures happening inside the college, the things being done by your seniors inside the college, you won't get to see at your home. So observation is one thing. Being up to date about a particular field, let's say reading articles, is not just a job of MDS graduates or students going through their residency. You have to be up to date with whatever procedure that you're learning. Let's say if you're learning composite restorations and GIC restoration, how about you go out and search for some articles onto composites, read their researches. Is there a better technique? Is there a better material? Is there something which you can do which makes your procedure easy? If you can do that procedure in a better manner. So it's all given in the articles. So scientific reading is again something I'll emphasize on. And one more thing which is very much missed by students is attending conferences. See, UG conferences are very economic. They carry a very good exposure. Speakers from around India, they come speak about their topics. There is something called as Indian Dental Conference being organized by the main branch of IDA. It's there every year in the months of maybe February or March. Every year it's being conducted. It's one of the best conferences which I've attended. And during my 5 years, I attended 4 of these conferences and presented a paper or a poster in all these conferences. So it's equally important to present something when you are there into the conference. See, it gives you, once you start presenting, let's say you're presenting on dental caries. So once you start preparing for dental caries for that particular topic or that particular presentation of yours, one thing is for sure that you'll be thorough about that topic for the rest of your life, or let's say for rest of your 3 or 4 year journey of your dentistry. So if you're presenting on composites, so you have to read a lot of articles, go through various textbooks, prepare your presentation, and then maybe present and speak confidently. So once you go and present these topics into different conferences, there is a different kind of confidence that you start gaining. The different kind of confidence that you start gaining in your public speaking and interacting with your fellow professionals. Now, this particular thing is in turn going to help you to convince your patients. See, the more confident you are in your communication skills, it would be more easy for you to convince your patients. And I said previously that the patients can judge your confidence just by the way that you speak and just by the way that you're expressing your treatment plan. So it has a twofold advantage.
Very well explained, sir. Following that, how can students handle negative comments or unfair criticism from teachers, or how when they are not at fault but are being scolded or being belittled?
Okay, how should I say this politely? But so there are some things which you cannot do anything about it, and that is how others behave on what and what others say to you. There's nothing you can do about it, actually. All right. Coming on to the negative comments, I would suggest that you actually introspect. Was that negative comment actually about your lack of skill, your lack of knowledge, or was it just that person was trying to humiliate you? Let's say if it is about lack of skill or lack of knowledge, I would suggest you go on, get better into your skill, because see, it happens. I'll tell you one good thing, that up until you are in college, your teachers might tell you that you're not doing this good or this was not done properly. But once you get into private practice, unfortunately, these teachers are replaced by patients. And patients tell you, कि यार डॉक्टर साहब आपने तो बहुत टाइम ले लिया, doctor you took too much of time, this was not done properly, I'm still having pain. So once you're into college, try to, I'd say this line, try to take things professionally, not personally. It is easier said than done. It's going to take a lot of effort for you to ignore all the unnecessary advice and unnecessary sayings. But to try to evaluate, was it your lack of skill, lack of knowledge, because of which you're not able to do that particular procedure and you're not, you didn't perform good into your viva or your patient, or was it actually the person trying to humiliate you, was trying to get something out of you in a nasty way? So for the later half is, let's say you were good with your you were good on your part, you did it everything correct and everything, and still your teacher or your senior made a nasty comment. It's unfortunate. It's there into our profession since years. It just tells you the person's maturity, I would say, and their character. If they try to belittle you and behave in an ill-mannered way, so I would rather say that कहते हैं ना, एक कान से सुन के दूसरे कान से निकाल देना, because there is actually nothing much you can do up to a point where that it's being unbearable, the person is going way beyond the limits, then you maybe can take up these matters to the college management or the administrative part. But if you can ignore, try to talk it out with a friend that I didn't like that my teacher told me this, and try to vent off your steam and not let that professional comment get into your personal life. It's there, it is going to be there. It's not the profession, it's the people in it. It's their character, it's their upbringing, and I'm pretty sure you cannot do anything about it. You cannot change people.
Moving forward to next question. What are the important things not taught in dental college and how can students compensate for that?
So, if we talk about the professional skills into this regard, let's say what I still remember is that you guys still do amalgam restorations in your preclinical operative. Yes or no? Yeah. So these things are outdated, not performed into clinics. Nowadays, it's either GIC or composite mainly. So if it is being taught into your college, well and good, try to learn. If not, let's say a particular college is still the old fashioned way, still making you do things. Of course, the curriculum is like that, and now we hope that DCI is replaced by NDC now. So maybe they'll just try to bring something new things into the curriculum. But up until then, you can maybe attend CDE programs. Hands-on courses are more important. See, rather than just attending a theoretical lecture, of course you attend the theoretical lecture, go on read those theoretical bits on your own, but try to attend these hands-on sessions. There are a lot of hands-on sessions happening for, let's say, composites, RCT. There are some skills which you need to learn before you venture out into private practice. See, scaling, you know, that you thoroughly learned during your dental college. Then GIC, I'm pretty sure you might just be able to do it. It's all sufficiently there. Composite, maybe you can go on and attend some hands-on courses. For RCT, you can go on attend some courses. Again, if you are into a college which has postgraduate teaching, I'm pretty sure everything would be covered into that college. So let's say the UG students are not being taught the composite restorations, please go on and assist your postgraduate senior. Be it a composite filling, be it a class 2 composite, or making a whole tooth out of nothing with the help of a composite restoration. Or let's say even if it's an implant being done by an oral surgery resident or a prosthodontics resident, go on there, request them that can I observe, if more can I assist. I'll just hold the suction, you just tell them I'll help you with your instruments. They would be more than happy to oblige, majority of the people. So yes, attending hands-on courses is a must. And secondly, as I said that just a second guys. So as I said that once you go on and keep on attending these courses, you start gaining skills, and then maybe get diverted into the private practice. So see, from the endodontic sides, it's RCT and composite restorations. In oral surgery, we expect you to do normal exodontia, basic exodontia. In prosthetic, what is expected from you is doing the tooth preparations. If not of molars, then at least for the anteriors, and taking good impressions. So let's say if you don't have patience, how about you try it, take your permissions from the teachers, and how about you try it with your friends and your colleagues. It's not I don't think it's going to harm you to practice alginate impressions onto your colleagues and to your friends. So get an alginate packet whenever there is free time into the prosthetic department. Go on taking good impressions. So that is expected out of you to do tooth preps in anterior tooth and take good impressions. Do a good thorough oral examination. You should be able to diagnose a particular condition. So Yeah, these things are expected out of you, and if you lack in any one of them, try to see if there are hands-on courses into your city. And secondly, once you start attending these conferences also hold hands-on courses, so you can enroll into them. You can meet different people. Those different consultants and doctors, they hold their own hands-on courses in different cities. So maybe you can just be in touch with them, get their contact number, try to attend their courses, upskill yourself.
The next question is on clinical readiness. Is the knowledge and training gained during BDS till the internship period enough to start independent practice? If not, what additional skills or learnings are required?
So what I believe is the curriculum which is there, curriculum given to you guys during the course of your dentistry, it's more than enough for you to go and start a clinical practice, provided that you excel and you learn all the procedures thoroughly. As I said that scaling is being given as dental students, and you might just do 15-20 patients. So you know one procedure. Second is doing restorations. Third is doing basic exodontia. If you don't know composites, maybe get on a class. Maybe tell your postgraduate seniors to teach it to you. See, the biggest thing that you can do is ask people. Until and unless you ask, the answer is always a no. So if you haven't asked your seniors to teach you a procedure, or maybe ask them a question that how to do this particular kind of procedure, the lack is onto your part. But I believe the curriculum given and the procedures being given to UG students from first to the internship, I think it's more than sufficient. Nobody is expecting you to remove a surgical, do a surgical extraction of wisdom teeth. That's the job of consultants. Nobody is expecting you to do an RCT in upper molar, let's say 1.6 or 1.7. You can call in an endodontist, but you are expected to do a tooth preparation. You are expected to cement a crown. You are expected to do scaling. You are expected to communicate the problem the patient is presenting with in clear, legible words. You are expected to diagnose a problem. You are expected to tell a treatment plan to the patient. So I believe, yes, the curriculum is good, it's thorough, provided that you pay attention to all these things, get thorough with your theoretical knowledge as well as practical knowledge, try to get as much as hands-on possible into your college. And if you're lacking into a particular procedure, let's say composite for instance, you can do a hands-on course. And for initial of your cases, let's say you open up your clinic and it's your first case, you know the procedure, but you're still inconfident, call in your senior from the college, call in a consultant, endo consultant, and tell them that you do this procedure and I'll assist you. So for first 3 or 5 cases, let them do the procedure. You will gain more confidence. And the 6th patient, you yourself do.
What basics should one focus on when starting a dental practice from scratch? Or how can one manage both MDS and clinical practice together?
Can you please repeat?
What basics should one focus on when starting a dental practice from scratch? And how can one manage both MDS and clinical practice together?
So as we just discussed, you should be thorough with your practical skills as well as theoretical skills. Again, running a clinic is different from dentistry. It's a whole different kind of a project. So you're not just a dentist, you are also an entrepreneur, because you have to look out for a space, negotiate the prices, get everything set up. When you're going out and buying the materials, you might just have to contact 4 or 5 dealers, see who is giving you the best rate. So that thing is entirely different from practicing dentistry. It's like juggling 3 or 4 balls with 2 hands. And talking about to manage clinical practice and MDS, I would say, what if you're preparing for NEET, and let's say you get the marks, and but you're getting the college which is not in the city where you have set up your clinic. So either you be thorough that you wish to do MDS, so rather not get into clinical practice then, or try to get a college which is there in your city where you have set up your clinic. So in that case, you can be in the college from morning to afternoon hours, and evening you can try and build your practice slowly and steadily. Any practice takes 5 years to build. So in the evening, you have to think about how to get in more patients, how to arrange more camps, how to reach out to more people and tell them about your clinic, how to reach out to the community that you live in and tell them that you have a clinic and you do dentistry or a dentist, and how to reach out to them, how to arrange camps for them, how to arrange uh, awareness camps for them. So that's a different kind of a ball game that you have here. But I would suggest that if you are thinking of pursuing MDS, so it's not into your hands that where are you going to get the college. So rather not set up the clinic first, see for the MDS college that you're getting. And let's say if you get it into the city of your choice or into your hometown, then maybe you can simultaneously set up your clinic. In the evening hours, you can practice general dentistry, and in the morning and afternoon hours, you can be in the college and gain skills into a particular profession.
Last question. Can an oral surgeon treat cancer patients? If yes, how does that role work?
So definitely. So after MDS in oral and maxillofacial surgery, uh, there are fellowship courses. You have to do fellowships in cancer surgery. There's a fellowship called as Fellow of Head and Neck Oncology. So it's a training of 2 years, sometimes 3 years, where you learn only cancer surgeries. Uh, it's usually held in hospital setups where there is a big chunk of cancer patients coming in. You train under different specialities, MCH oncosurgery, and already the people who have done fellowships in oncosurgery. So yes, you can do cancer patients after a fellowship course, after your degree. But up until the degree, once you've got the degree, you can take biopsies and remove small lesions such as leukoplakia, lichen planus, or uh, uh, any ulcer which is there which requires a biopsy. So that doesn't require a special fellowship. Just your degree would suffice for that. But doing cancer patients would require you to undergo a fellowship training.
Thank you so much, sir, for such an engaging and enlightening session. Before we wrap up, if anyone wants to unmute and share something, a question, an experience, or maybe a feedback, you're most welcome to drop your questions in the chat box.
There was a question about real world insights for practicing in India versus foreign. So anybody thinking to go to a different country to practice dentistry, I would suggest you to get connected with people over there. Try to find out more and more about those particular practices over there, because see, we are very much misconcepted about dentistry here and being practiced outside, the struggles here and the struggles outside. We have this common notion कि बाहर so there is too much just a second, my battery is so while I was after completing my BDS, I also had the aim to go out and practice dentistry in either US or Canada. So what I did was, rather just preparing for those exams, I would suggest you to reach out to people on LinkedIn, on Facebook, on Instagram who are pursuing those degrees over there or practicing dentistry. Get real world insights of how difficult it is, what are the steps, how difficult and challenging it is, and then you would realize soon enough that if you do a good master's here, get skilled into a particular profession here, I would still suggest anybody that India is way better than other countries. There was this one more question: should college just be studies? This is the age when you just want to do everything else out there, hang out, traveling, sports, just quality time with your friends. So I would strongly suggest that yes, it's not just studying. You should also indulge into hobbies, get into sports, spend your evenings wisely, because all study and no play makes Jack a dull boy. So anything else if you can come up with, and I might just be able to help you out, let me know. All right then, let's wrap it up.
Thank you so much, Dr. Rupani, for such an insightful and honest session. I think we can all agree today's session covered the things we usually figure out the hard way, and this is just a little earlier for us now. Your experiences and practical advice has definitely given us a clearer direction and a lot to think about as we move forward in our journey. We hope this session not only added to your knowledge, but also made you feel a little more prepared and maybe a little less surprised about what lies ahead. We look forward to bringing you more such sessions to find roots of Dentinos. So do stay connected with us. Thank you once again and have a great day ahead.
Thank you so much, guys, for being here on a Sunday morning, and I would be more than glad to help you out if you wish to reach out to me in future. Maybe we can get connected on LinkedIn or Instagram, whatever you wish. It's fine. I'll be more than happy to guide you if you face any problems in future. Just remember this: that stick a little longer with your problem. It will be solved. That's the mantra for today. Just stick a little longer. That's all.